Hello, my name is Megan Philipwitz. I am a nursing student at Indiana State University, and this is for my nursing course with Dr. Lucky, and today I'm going to be talking about endometriosis. The objectives for this video are as follows: to determine who is at risk for endometriosis, to define what endometriosis is, list the signs and symptoms of endometriosis, discover common risk factors for endometriosis, list resources for more information about endometriosis and community support, determine treatment for endometriosis, and educate on ways to decrease your risk. At this time, if you would go to the link in the description, click on it and take the pretest now. This is just to gauge your current knowledge on endometriosis. Once you're done, you can review the answers to the questions at the bottom and then continue on with this presentation. So what is endometriosis? Endometriosis is where the lining of the uterus, what sheds during a period, grows outside of the uterus. This can be anywhere within the abdominal cavity. It can be on your bladder, your intestines, or anywhere else where it doesn't belong. This can lead to mild to severe pelvic and abdominal pain, painful periods, pain while having sex, and even endometrial cancer at its most extreme. So what are some signs and symptoms of endometriosis? Painful periods, frequent pelvic pain, pain during sex, frequent urination or pain with urination, cramping, spotting, and even infertility. Because with endometriosis, the endometrium grows outside the uterus, it sheds at the same time that your period would regularly shed, and this leads to the painful periods, spotting, cramping, etc. So what are some risk factors for developing endometriosis? Gender, being female, increases your risk of developing endometriosis as it is particular to a disease of the uterus. Never giving birth is also a risk factor. Starting your period at an early age below the age of 11. Going through menopause at an older age, over 65, short menstrual cycles, for instance, less than 27 days, heavy menstrual periods that last longer than 7 days, and a family history of endometriosis all increase your risk of developing endometriosis. So how is endometriosis diagnosed? Pelvic exam is one of the first exams done to determine your risk for endometriosis. They may discuss your medical history. If you have family history of endometriosis or have described any of the previous listed signs and symptoms that may describe endometriosis, they may want to do an ultrasound. An ultrasound may show the little lesions of endometriosis outside the uterus, although it isn't always entirely accurate and may miss some things, which is why the most definitive way to diagnose endometriosis is exploratory surgery. During this, the provider will do a laparoscopy, which means they make tiny incisions, typically with a robot, and use a scope or camera to see inside your abdomen and look for endometriosis outside the uterus. If they see samples that look suspiciously like endometriosis, they will take samples or biopsies of this tissue and send it to pathology to determine if it is truly endometriosis. Once this surgery is done and the results are back, you will have definitive answers as to whether or not you have endometriosis. So what are some treatment options to treat endometriosis? First, they may start you off on different medications to help suppress endometriosis. Endometriosis can be exacerbated by excess estrogen within the body. Estrogen is one of the hormones that females have that increase during periods. Higher levels of estrogen increase your risk of developing endometriosis and form as a way to feed the already lesions in your body. What I mean by this is if you have increased levels of estrogen in your body, the endometriosis may grow. There are certain medications that can help suppress these estrogen levels. First off is a medication in its own class known as Orilissa. Orilissa mostly works to help decrease pain levels because of endometriosis. Another example would be a form of birth control known as the mini pill. This specific form of birth control excludes estrogen, meaning that it won't help feed the already existing endometriosis within your body. This will help suppress or stop further growth of endometriosis tissue in your body. The most extreme but effective treatment for endometriosis would be a hysterectomy, which means removal of the uterus from your body. Without the uterus, the estrogen levels will not fluctuate as much due to periods or menopause. And without the uterus, the endometrial tissue has nowhere to spread to as it originates from inside the uterus. So you may be wondering, what are my resources? The first resources I have listed is healthywomen.org. This website gives several community resources and not only talks about endometriosis, but other health concerns that are specific to women. There are different resources. You can look through the definition of endometriosis, as well as treatment options and other health-related concerns regarding women. The next website I have chosen is called Speak Endo. It is speakendo.com, and it also gives resources and community support. There's support groups that you can talk to if you've been diagnosed with endometriosis. There's other resources. They give links to other websites if you want more information about endometriosis or about treatment options. Lastly, I have endometriosis.org. This specifically is for endometriosis only, gives information about endometriosis, treatment options, when to seek a provider, signs and symptoms, etc. And that concludes the end of my presentation on endometriosis. I want to thank you for following all the way along, doing the test, and even looking into any of my resources. Here are the resources I used to find and describe all the information in my PowerPoint. And if you ever have any questions or concerns that aren't answered in this PowerPoint, it's important to reach out to your primary care provider, especially if you have any of the signs and symptoms listed in this PowerPoint, as it may be a good idea to discuss this with your provider about possibly testing for endometriosis. Thank you.